You talk about holding space, energetic space, or giving the room or space for the entire person to show up, not just their symptom. And lots of times their symptoms are a reflection or of past trauma or emotional trauma. And I think a lot of doctors, especially in physical medicine, don't want to necessarily open that door because either they don't feel prepared to handle it because they're not trained in therapy, or there's a fear that if I open that Pandora's box, then I'm not going to know how to close it, or it's going to become a really long visit. And the research on this shows that it only takes 40 seconds. It actually only takes 40 seconds to hear someone's emotional need, respond that you've heard them, and that you're going to be there with them every step of the way. And the research also shows that the average clinician only gives a person 17 seconds to actually say their chief complaint before cutting them off. So you're very conscious about your creating a space, creating a container where people can show up. Um, do you find that creating a place for someone to voice their past trauma or emotional needs or current emotional state becomes this long drawn out conversation, or is it the opposite?
I don't think it is. And I think people understand that that's not what we're going to do is fix this with more talking. But I think sometimes just putting words to the feeling that comes up either before or during treatment, um, and describing it with some connection to another person that can hear it is enough.
Hmm.
I don't think my patients expect me to fix any of those things. But if
Hmm.
I know it's there and the pattern of what they're thinking about
Hmm.
is there, that helps me understand other things about what I need to look for from a physiology or a structural place so that I can handle that visit better and more effectively and get through what I need to, kind of open that file and then fix a thing and then close that file for the day. Um, and so knowing all of it is important. And sometimes I just need to hear that while I'm treating them to kind of release the thing that's stuck,
Hmm.
or to at least connect the dots for me at the same time as for them so that we can both get them a little bit better that day.